Welcome back to Consumers Doctors Live channel. On the behalf of the foremost organization, we welcome you all back to the regular channel, which is being recorded 7 a.m. on a daily basis. Today's topic is healthcare consumerism. Healthcare consumerism. If you're a consumer, a health insurance consumer, efficient free markets always respond to consumers' demands. They do, for products, services, and information. That's the way it's supposed to be. It's time to try a system that focuses on a customer and the patient's needs. So it needs to be consumer-driven, patient-centric system, folks. Consumer-driven, patient-centric, which is otherwise called personalized healthcare systems. Some will tell you that we have already tried free market approach in the years prior to Obamacare or Affordable Care Act. But pre-Obamacare, insurance was not a free market. It was not based on free market, folks. You and I know that was a bad system. Yes, it was a bad. Before Obamacare, the healthcare lobbyists had their way. Health insurance lobbyists had their way, and structure included laws and regulations. What were they? Well, number one, consumers were powerless when seeking to purchase coverage. They were powerless seeking to get coverage. This is prior to the Obamacare. Number two, insurance restricted providers and services patient could access. They restricted the services and they restricted the providers for the access. That's number two. Number three, cost and quality information was hidden. Cost and quality information was hidden from all the consumers. And number four, individual consumers had no power to negotiate premiums. They did not have any power to negotiate premium or understand why they were rejected for the coverage. Why they were rejected for the coverage. And number five, few powerful insurers, limited coverages, limited provider alternatives, plan choices, limited innovation, and limited pricing competition. Those were the things. They were not free market. They were basically controlled by the few insurance companies which controlled the market. That's one of the reasons why there were so many uninsured and there were so many people were having issues with their premiums, with the coverages, and the restrictions. On many fronts, they have had problems prior to the Obamacare. That's one of the reasons why, and people were getting these surprise medical bills. They were going bankrupt. Individuals were declaring bankruptcy because of their premiums and surprise medical bills. That's one of the reasons why President Obama came up with a brilliant idea of Affordable Care Act, which basically was trying to compete with private insurance markets. That's what he did. He brought a competition to the private insurance. Maybe it's a good thing that focused our attention. But one thing I should tell you, Affordable Care Act did focus on few things. Pre-existing illness. It focused on pre-existing illness, number one. Number two, guaranteed coverage, number two. And number three, focused on people, through a public option. So basically, they had no choice. They were given government subsidized choices, whereas there's no limited competition again. And there was limited choices for the consumers. Consumers were never in the front line, given under the Affordable Care Act. They started this bronze and gold and platinum. That somehow it was forced upon us but it did help us in focusing on certain things like pre-existing certificate of guaranteed coverage and major medical coverage, catastrophic coverage. Those are all things which we would like to embrace in personalized healthcare system, or so-called healthcare consumerism, which is a public-private partnership, folks. It is a public-private partnership. What you all may not know, the laws and regulations are mostly written by the insurance industry lawyers. Even in because consumers were never given the rights. It is all lobbied from these insurance companies. Most of you guys are not aware. For the insiders, limited competition, market share drives the process. Consumers were totally ignored. Consumers were totally ignored. We don't want to revert to that system again. We can't let insurance industry lobbyists write the laws post-Obamacare. Yes, we don't want the insurance lobbyists to. And insurance lobbyists supported President Biden. Now they're back in the game, limiting the competition, limiting the choices. Consumers, it all depends on the upcoming senatorial race in Georgia. What will happen? Basing on that, our healthcare system is going to be in the balance. We were all shafted for the second time under the Obamacare. So we don't want a third act trying to crush the people's choices. Consumers need to be given the right choice, folks. Consumers have to be engaged, involved. Premiums need to be affordable. We are consumers. Efficient free market always respond to the consumers' demands for products, services, information, like what we are going through these other retail industries, including the grocery chain, food industry. We have seen the consumer demands plays a major role, which is not there in healthcare, We have never had basically the consumers were ignored. we were being essentially, consumers were shafted all over again. Consumers being ignored on a regular basis. You are a consumer, and that they're not the representative whom we elect, they're not listening. We need to have freedom in healthcare, folks. We cannot be dictated by either the insurance lobbyists, bureaucrats telling us where to go, what to do. And we need to have a system where we need to have a choice. We need to have a premium which is affordable. We need to have premium which is affordable. These politicians and insurance companies aren't working to help us. Help you or help me. They're not helping us. Politicians have been promising repeal and replace for last 10 years. Yet nothing gets done in Washington. Nothing gets done. They're either unable or unwilling to develop an alternative to Obamacare. That's what I see. That's what I see. Moreover, since 2002, where they have introduced this health savings accounts, insurance company lobbyists have been fighting hard against expanding account-based plans and health savings accounts. Why? Because HSAs put some control into the hands of the consumers. That gives them the control to the consumers. What I see is we have to recognize the truth. We all have to recognize the truth. Lobbyists and existing vested interests will preserve the status quo, will preserve the status quo and work against your interest. Your interests in choices, treatment options, and including the affordable insurance, folks, including the affordable insurance. It is time we demand, the changes and acknowledge our unique needs, so-called personalized health insurance. Personalized health insurance is such, through HDHP, they call it high deductible. I call it as health disclosure, healthy pricing, which will lower your premiums. It's a basically deductible plan, folks. If you have a deductible, if you have this much deductible, your plans gets lower. It's a simple concept. It's like auto insurance or home. If you have a deductible, your premium. This is what the same concept, folks. I would call it as health disclosure, healthy premium, because once you have a deductible, once your premiums are lowered, you can put money aside into the HSA. I wouldn't call it health savings. I would call it health solutions advantage or rainy day fund. It's a better term is rainy day fund. These insurance lobbies have been fighting against rainy day fund because they don't want us to have a rainy day fund for our future healthcare needs. That's what they have been fighting. They don't want us to be in control. When you have a rainy day fund for your future health, you would rather pay from your pocket and collect all the bills and take out the money from your rainy day fund, not penalize. Rainy day fund, HSA, Health Solutions Advantage, has 3 triple tax benefits, folks. There's nothing like it. So-called a rainy day HSA Health Solutions Advantage. What it is, contributions are deductible from your taxes. Compounding, if it's in the market, if it's the returns on your investments are tax-free. Returns are, you get 10%, 15%, whatever. It is tied to the index fund, mutual fund, so they're tax-free. And taking the funds out for your health reasons is tax-free. You accumulate all the bills over 10 years, you can withdraw 10, 20, 30 grand tax-free. Over a period of lifetime, folks, a lot of people don't realize this rainy day, so-called HSA funds, individuals can accumulate 100, 200, 300,000 if they contribute on a regular basis, folks. I understand what you guys are saying. People don't have the money to contribute. We will come to that. There is a way to do it. In healthcare consumerism, there's a way to address that. People in the lower socioeconomic status, they will have a guaranteed personalized health coverage. The Health Review Board, through public-private partnership, will issue an insurance, which is private. It's better than Medicaid or Medi-Cal. Right now, Medicaid, Medi-Cal, none of the providers seems to be accepting. It's worthless, folks. We need to have a personalized certificate of guaranteed coverage to all Americans. Yes, we need that. And we need the consumers to make the choices, not the insurance companies, folks, not the providers. You and I want coverage, improvements, affordability, more treatment, and healthcare options. We all want that. But when you have a public option, those are limited, folks. It is all, instead of having a just simple public option, I'd rather engage public-private partnership, create this health review board, and it creates people and segment the risk of the segmentation, risk segmentation. Right now, our insurance premiums are based on general risk pool. If you segment the risks into 4 categories, well category, at-risk category, chronic illness category, and catastrophic category. If you segment that, our premiums will go down, folks. Yes, our premiums will go down. We can't let the government or insurance bureaucrats come between patient and provider relationship. We want direct doctor-patient relationship. They cannot come between the doctor and the patient. We cannot let them set rules that tell doctors what they can do and they can't do. They can't. That's not right. That's not right. And that's not the option we are all looking for. They cannot be allowed to say whom you can see on healthcare, where you have to go, which lab you have to go, which facility. They cannot tell you. It's your choice. That's what the freedom what we need. What treatments you decide. This is your asset. They cannot. Your government cannot come between you and your body, your health, your provider. They cannot get in between us. And we need to focus on that. This personalized health insurance will improve the delivery of care, lower premiums, improve quality of treatments, and gives new choices, As for the coverage, personalized health insurance includes most popular under Obamacare, consumer-oriented features. Personalized healthcare focuses on those points. This is what Obamacare brought, and we're going to implement all the aspects of Obamacare. And this gives better choice under the personalized. What are those choices? Because Obamacare, we are going to embrace all the choices from Obamacare through public-private partnership. What are they? You guys might ask. Number one, certificate of guaranteed coverage, guaranteed issuance of insurance to everybody. Yes. Number two, coverage of the pre-existing conditions. Personalized healthcare embraces that. Pre-existing coverage. And number three, dependent children. The transition from the parental coverage to the individual coverage. 26, yes, we all embrace that. We all embrace all that. And number four, unlimited lifetime coverage, maximum. Unlimited lifetime maximum. And number five, these are all from Obamacare. We want to embrace all that under the personalized healthcare. And number five, comprehensive major medical insurance coverage, folks. We are embracing all that in the personalized health insurance through HDHP, HSA, so-called HDHP, HSA, health disclosure, healthy pricing, so-called deductible plans, which will qualify you for a health solutions advantage, HSA, savings, rainy day fund. Your rainy day fund, like, right now, we don't have a rainy day fund. It's called HSA accounts, folks. We all need that. Like, state of California wants to have a rainy day fund. Federal governments want it. We want a rainy day fund for our future needs, man. Our future needs. Personalized health insurance builds on the strengths of this country, folks. Freedom. Builds on those principles. It includes efficiencies, innovations, choices. It includes all that. And consumer focus of a free market with consumer protections. Consumer protections, we are embracing that. This is what all the retail industry, consumers have a protection. Even the personalized healthcare participates in those protections. So we all have protections. Patient empowerment and limited government oversight, folks. Limited government oversight. It does not include least popular features like what we have today, such as price distortions. Price distortions by the age. Just because you're certain age, they give you certain premium. They're all distorted. They're not right premiums. Excessive coverage mandates. They tell you there are too many mandates in the coverage. Limited policy choices. And the single risk pooling, which needs to be scrapped, folks. We need to have a segmented risk pool, not a single risk pool. If we cannot unite around a version of consumer oriented, personalized health insurance, then surely we'll, we will all head towards one size fits all government, top to bottom, that fails to meet the unique insurance needs for all of us. We need to wake up, man. We all need to wake up. We need freedom in healthcare. We need freedom from shackles of healthcare. You know, when our health insurance, you know, believe it or not, the public-private partnership will lower the cost of the healthcare. The way they are suggesting one-size-fits-all approach, the cost will, you know, go up, and we don't have the money. We are under $25 trillion. How are we going to get, where are we going to get these funds? Personalized healthcare, it engages public-private partnership. It gives the consumers in control. It's consumer-based, patient-centric system, folks. Thank you for joining this channel. Foremost Organization, on the behalf of the Foremost Organization, I welcome you all as a consumer's doctor. I love to hear comments from you guys. I love to hear your feedback. It's so important for me, folks. As Foremost Organization is a nonprofit focused on healthcare, research in healthcare, access to healthcare, and freedom in healthcare. And the Foremost Organization wants to be in the models of Kaiser Foundation. Kaiser, Kaiser has been a successful model, but Kaiser is the last one to embrace. You know, you all know whenever there's a new issue comes up, Kaiser is the last one to embrace. Even the managed care, HMOs, Kaiser embraced it last. Right now, personalized health insurance, I would like to see either the Kaiser or through Foremost Organization. We want to embrace, which is focused on giving the quality care where consumers are in charge. And Foremost Organization, brick and mortar is owned by the Foremost, but when it comes to the staff model, it is all fee for service, for-profit model. So Kaiser model is the way to go. It is the way to go. And Foremost Organization would like to follow in the steps of the Kaiser. Folks, thanks again. We'll see you in our next segment. We welcome your comments. As a consumer's doctor, I salute you. Thank you.